What do you know about cervical cancer?
I know that it has to do with something called an HPV virus. You have to go and get a pap smear twice a year, type of thing, yeah.
I know that cervical cancer is a cancer that affects the uterus. That's about it.
Cervical cancer is actually an uncontrollable growth of somatic cells on your cervix. So yeah, it's basically uncontrollable growth.
Well, it's basically a cancer related to like your uterus and the cervix area. It affects ladies.
Do you suffer from abnormal bleeding between your periods? Are they heavier? Are they longer? Do you have an abnormal vaginal discharge? And do you sometimes have pain during intercourse? Well, these could all be signs of you having cervical cancer. Good morning. I am Dr. Musawinkosi Mtombeni, and signing with us is Nono Nyovana. Today in Vital Signs, we focus on cervical cancer and HPV. And Cervical Cancer Awareness Month is commemorated annually in September to encourage women to do screening and prevent the cancer. Now, the goal of screening, of course, is to ensure that the cervical cells are found, and if those have changed early enough, then you're able to see this before the big symptoms actually come about. Now, coming up in the program, we'll listen to an insert produced by Zama Buthelezi. She spoke to a young woman about how early detection can save lives. We'll speak to obstetrician gynecologist about cervical cancer, and we'll speak to the manager of the Integrated Schools Health Program from the National Department of Health about the human papillomavirus and the HPV vaccine program. Zama Buthelezi will take us through the latest COVID-19 numbers, and Dr. Marlon McKay will answer your questions on COVID-19 and any other thing that you may want to bring about. Remember that you can be part of the show by asking guests some of the questions that you have in your mind by sharing your views with us on what we're discussing. The number to call is 011-714-5861 or 011-714-5877. You can also share your thoughts with us on social media using Twitter at SABC Vital Signs or our Facebook page, SABC Vital Signs. Vital Signs continues right after the ad break. Welcome back. This is Vital Signs. I'm Dr. Musa Mtombeni. 2018 Mrs. SA runner-up and businesswoman Mankwana Nhlebela is the living testimony of the fact that yearly screening and early detection for all cancers does save lives. Nhlebela was never prepared for the news that came after she started, or what started as a routine visit to the gynecologist in preparation for the next phase of her life, which was getting married, and she's been doing yearly visits to the physician like most women. Then, at age 27, Nhlebela will forever be grateful for the life-saving visit that she had. She sat down with Vital Signs producer Zama Buthelezi, taking her back to that period of her life. Let's listen to the story.
Mankwana, thank you so much for talking to us. Tell me, as women, we are told that we need to go for checkups regularly. Did you used to do this?
For me specifically, yes, I did. I think I started when I was in university, and mainly because we'd have some drives on campus that would tell us to use the free facilities. So we had a clinic there. So I started there, and I think that was, great for me because I had access to that information. And then when I started working, I would go to a general practitioner once a year, at least for my pap smear.
Just take me back to the day you first went to see the gynae now. How old were you, and what prompted you to visit the gynae?
So I was around 27. I was about to get married. I think I was 2 weeks to getting married. And I think in the hype of, trying to get married and getting prepared for everything, I just jokingly said to a friend of mine who had constantly been saying that she goes to a gynae. And I said to her, you know what, I'm getting married. Let me just go and do a checkup. And that's exactly what I went for. So I went there. It was simple. The doctor or the gynae made me feel so comfortable. It was a quick in and out, did the pap smear, and then I was out of there.
Take me back to that day when you received that call about your results a week later.
It was on a Wednesday, I remember very well. I was in the office at my desk, and I remember getting a call from the gynae, and he said to me, do you have a pen and paper? Write 1 to 5. And he said to me, 5 is like cancer, or at that level. And then he said they found abnormal cells at stage 4, if I recall. I mean, at that time, I think everything just went over my head when they set up normal cells. And I thought I just came here for just a quick checkup. And then the next thing he said to me, you need to come in immediately to do a procedure to remove the abnormal cells. And I mean, I jokingly said to him, but I'm getting married on Saturday. I'm not coming, you know? And he said to me, okay, that's fine. But you get married and you come through to me the next day. And I think it happened so fast. It was like a surreal moment because, as I mentioned, I just went there for a simple checkup. I had done so in the previous years. And he literally said to me, had I come 9 to 12 months later, it could have become cervical cancer.
Talk about the worst time of your life. Here you are preparing to get married. It was supposed to be such a joyous time for you, and you get such news. Tell me, Mangwana, was there anyone in your family who had cancer, any form of cancer, or even cervical cancer?
At that time, the doctor actually did do a check to check if it was something that was genetic. So they did firstly a check for HPV of the virus itself. They didn't pick up anything, and then they did a genetic test. And I think that's when I started asking, my family members if there were any history of that. So at that point, I do remember that possibly my aunt had a similar scare a few years ago. And in the same time, that same week, I actually lost my grandfather the very next day after receiving my results to prostate cancer.
Oh, the doctor had said, after getting married, you need to come here. What did you do? Did you listen to him? Did you go for surgery shortly after getting married?
Cancer is a reality, and I was very aware and conscious of that. So I didn't take it lightly. So I did get married the Saturday, and Monday, literally, I was in theater. They did, a laser incision, and I was out. I mean, I didn't even sleep overnight. I was literally out the same day. So I did listen, and I can definitely say that decision saved my life.
So, Mangwane, after the procedure, did you experience any side effects? Were you on treatment? What happened?
After the procedure, I think a bit of discomfort. I mean, I did go into theater, so that's to be expected. But in general, I did not suffer any other ones that I could say were severe to really highlight. And thereafter, it was, being very conscious of going for checkups. So it became more a 6-month checkup instead of just an annual one, just to make sure that there was no the cells coming back, I guess, if I can put it that way. So I made sure that every 6 months I would go to the gynae and to get my pap smear done.
Were you able to conceive after your procedure?
As a young woman who's just gotten married, of course, that was a concern. I mean, you've just gotten married and now you're going in. But I think, the doctor gave me comfort to say this is actually saving me. So it would be actually good for me. And yes, to your question, I conceived perfectly. I've got 2, healthy kids. One is 1 and one is 6 years old. So yes, I was absolutely able to conceive babies.
After the break, we speak to Dr. David Maringa, an obstetrician and gynecologist. See you after the break. Welcome back. This is Vital Signs. I'm Dr. Musam Tombeni. And according to cancer, cervical cancer is the second most common cancer among South African women, but the cancer that women die of the most in our country. Experts say early diagnosis and treatment of precancerous lesions leads up to 80% of cervical cancer in high-resource countries where cervical cancer screening is routine. Now, it's also very important that women do not stay away when they receive abnormal results. Now, cervical cancer is highly treatable if caught in the early stages, and treatment should start as soon as possible for optimum results. We talk about this cancer. We're joined by specialist obstetrician and gynecologist, also fellow gynecological oncology joint lecturer, Department of Obstetrics and Gynecology at the University of the Witwatersrand, Dr. David Maringa. Good day, Doc. How are you today?
I'm well, thank you, Dr. Mtembeni. How are you?
Good. I think a a lot of people like having this, cervical cancer discussion when a lot of people don't actually understand what the cervix is. Can you kindly take us through some very basic anatomy for everyone at home to really understand what we're talking about today?
Okay. Well, greetings to the viewers at home as well. Thank you so much for this opportunity. So a cervix, from an anatomical point of view, is an organ. So the term cervix actually is a Latin-derived word that actually means that it's the neck. So it's basically the neck of the womb. So this is an area that actually is very important in terms of, giving the basically entry into the womb. And it's about roughly 3 to 4 centimeters in length. That's the anatomical size of it. And I mean, the most functions that it offers. So first and foremost, is to actually make sure that it's a passage into the uterus. And also it does help when ladies are going on to their periods every month, that it actually slightly opens up a bit so that, the menstrual blood can come through. Secondly, also this cervix it also assists when ladies are, getting pregnant as well. So it tends to open up a little bit before ladies get pregnant. And so it helps the sperm to actually go up. And also it covers and it protects the fetus when the lady is pregnant. But also it's got a role to play when now this lady goes into labor, because now this is the passage where the baby has to pass through so that the baby can be delivered and the baby can actually come through into the world. So basically those are the basic functions of the cervix, and that's how it actually helps us. And remember, the uterus is a sterile environment. So the cervix itself closes that area, and it actually protects this sterile area, which is up the uterus.
So, I mean, it's very difficult to speak about things such as the cervix when it's not something that you casually see or something that the normal person can see themselves. I mean, there are cancers like breast cancer where someone can actually look at themselves and examine themselves and go get treatment if they think something's abnormal. But things are different in the spectrum of cervical cancer. So for someone that might have a cervical cancer or any precancerous lesions, how do we get to a point where we find out that they actually have these lesions?
All right. So, I mean, this is where screening is very, very important. So as you rightfully said, ladies cannot, know or see their cervix, which, as we know, if people do not see something, they then think that everything is actually fine on that thing. The issue becomes, in the fact that once you actually, so this is a progressive thing. For you to actually get cervical cancer, it does not start by just being cervical cancer. So what happens is that it actually starts by having what we call an infection by HPV, which is the virus that actually causes these changes on the mouth of the womb. And then it progresses to what we call precancer cervical lesions. And these are the lesions that we actually, encourage ladies to screen. So as they screen, we as obstetricians and gynecologists or any other generalist will be able to have a look at the cervix, will be able to do what we call pap smears. And there's other methods of screening, which we'll talk about as we go through. But the most common one being the pap smear, which is the papinoculum smear. So they do that. They actually, we do a smear onto it, and then the results will come back and they will tell us, what is happening. So meaning what we are actually emphasizing is the screening. And that's what we are going to talk about. So ladies must actually, we encourage ladies to actually go and screen so that we can avoid them finding this quite late. Because once they start having symptoms, then already you have cervical cancer, which is then a problem.
So, I mean, I think the big problem that a lot of South Africans face is that they don't routinely visit a doctor. They don't routinely visit a gynecologist, someone that's a specialist. So how do we encourage women to get to a point where they can visit facilities or visit a doctor? How often should someone go see a health practitioner in order to screen for cervical cancer?
So, Dr. Mtomeni, it depends, all right. But what has been said before is that ladies need to have yearly screening. So just like any other condition or any other diseases that are not just only gynecological, we always encourage that ladies or any kind of a human being should have, yearly visits to a doctor. And so, I mean, if now we are talking about women's health in particular, then we would then say at least ladies they must visit their gynae at least once a year. And this is what has been, has been happening before. And that's when we are able to actually do all these investigations or all these screening tests, because they form part of a basic gynecological examination.
So what are the risk factors that someone needs to look out for if they think that they, could be having cervical cancer or pre-cancer type lesions?
All right. So the biggest risk factor, let me actually just say and mention that it, as we mentioned, that this is caused by human papillomavirus. So the biggest risk factor is actually acquiring the human papillomavirus. This human papillomavirus is acquired through sexual contact, but once you have the human papillomavirus, then when you get to a point where, so normally the body will actually clear out the human papillomavirus. But now, if the problem, if it persists, then that's where the problem becomes.
Okay.
So other risk factors, so if you've had, a lady that has had intercourse before, right, that already, it's the first things first. So in terms of the screening, we always say that if you've had a sexual encounter, whether it's through protection or without protection, then we encourage you to actually start screening, because that's a risk factor on its own. Smoking has been mentioned. It's one of the major causes of progression into cervical cancer, because smoking actually affects the human, the host immune defense, so that the body can actually clear out the HPV. But there's other things that have been mentioned, like, safe sexual practices. So if people don't have safe sexual practices, meaning they don't use barrier methods, they have multiple partners, that's a risk factor. We talk about, the prolonged use of oral contraceptives, although that to a certain extent has, its own controversies around that. But it's all about actually the acquiring of the human papillomavirus. The biggest risk factor as well, Dr. Mtombeni, is if ladies do not go for screening. Okay. If people do not go for screening, then that's a biggest risk factor, and it causes problems for us, because then, these ladies can actually, are at risk of developing these lesions, which can progress to cervical cancer. But it's all about the acquiring of HPV and the clearing it out. HIV infection has been mentioned as one of the main drivers of a risk factor for you having cervical cancer. Ladies who are on immunosuppressive agents, so ladies who are on renal transplant and they're actually getting suppressive therapy, they are actually at risk of developing cervical cancer. So it's all about the immune system, basically, because as I mentioned to you, that it is the persistence of the HPV that causes ladies to have these changes on the mouth of the womb that can then predispose them, or they can cause cervical cancer.
So before we head into what happens once we've found a precancerous or a cervical lesion or problems, let's chat about what South Africa is looking like with respect to cervical cancer in terms of screening, in terms of treatments and things such as that. What does that look like?
So we were quite poor, let me say that, but of late, we really have improved. So currently on a study that was actually done around 2019, this is obviously just before we went into the COVID pandemic. Studies have actually shown that we've got a 65% uptake in terms of cervical cancer screening, which is quite good. We're still not where we want to be, because by global standards, countries have actually, in the first world countries, they've reduced, the burden of cervical cancer significantly because of the fact that they are screening more. So we need to actually improve onto that. But 65%, if you compare to where we are 10 years ago, where we were roughly at about, 30% and all those things, that is really an improvement. So we're not looking bad. That's the first thing in terms of screening. Of late, we have, since 2014, actually we've had the HPV vaccine that has been available to us. And remember, you will remember that I've mentioned that HPV is the driving factor, of cervical malignancy, or the progression of pre-cervical malignancy, pre-cervical malignancy lesions to cancer. So Now, the government has actually in 2014 introduced, a drive where ladies or girls, young girls between the ages of 9 to 14, at school, they can actually get the HPV vaccine. And that has shown in different studies, globally, that it has really, really reduced the burden from, both the incidence and both the mortality that actually is caused by cervical cancer. So as a country, if we're looking at ourselves, we really are getting better. We're not there as yet. We still can improve, but we really are getting better.
So let's talk about someone that finds out that they've got this pre-cancer lesion or has got an actual problem on the cervix. There's a cancer there. What are the steps that follow that?
Okay. So the way in which you would actually do that is obviously if we go and we do the screening, the most common one is the cytology, which is the Papa Nicolau smear or the pap smear. The other thing that we can also do, I'm just adding, or as we are actually talking about it, is that we now are able to test for the HPV DNA as well. Okay. So that has been included as part of the screening. So when a lady finds out that they've got a pre-malignant lesion, it depends because now you have different types of these pre-malignant lesions. Let me just mention that for you to have cervical cancer, it has to be a histological diagnosis.
Okay, what does that mean?
As I'm about to mention, as we're going into the details, when we say a histological diagnosis, we're actually saying that it's a diagnosis that's made by us taking a piece of tissue.
Okay.
So there has to be a piece of tissue that has to be taken, while the PAPS actually looks at just the cells. So the pap smear is a screening method. It will screen for us, and it will tell us if this lady is at a high risk of getting cervical cancer because then they have this pre-malignant lesion. When that happens, there's different things that you have to look into. Is the patient immunocompromised? That actually, takes factor into it. Is the type of the cells that we're actually seeing under the microscope. So you've got a broad classification where these cells are classified as what we call a low grade, and some cells that are classified onto a high grade. While there's cells that are in between, where we're saying they are atypical cells, where we cannot really prove with certainty if are they of significant abnormality or are they of a high grade type. So when a lady actually comes in and we look and we find that they actually have what we call a low grade kind of a lesion, we would actually then look at the clinical factors, because we're not just looking at the test itself. We look at the clinical picture to see how the cervix is looking. Is the cervix grossly abnormal or anything, any abnormalities onto that? So if they have a normal cervix, what we can do is that, if the lady is clinically fine, there's no other issues, you would then give them, because we follow what we call South African guidelines.
Yes.
You would then repeat the smear either in 6 months or in a year's time. Obviously, the health practitioner will then, decide on that. If unfortunately the results come back and they show that it's a high grade kind of an abnormality, then this lady is subjected, or we need to do a further test that will actually then confirm, as I said, by a biopsy. So we look into the cervix, we can subject them to what we call a colposcope, where we look through actually a special microscope when we stain the cervix, which is the mouth of the womb, and then we take the biopsies from there. And then the biopsies will then come back and confirm to us if is this a pre-malignant lesion of a high-grade type, or is it a pre-malignant lesion of a low-grade type, or is it a malignancy?
All right. Doc, I've got a question here. We've got Ndando from Cape Town who'd like to ask a question. Ndando, good morning.
Morning.
Yes, the doc is here. We don't have a lot of time. Please ask your question.
Okay, my question is about incompetent cervix.
Okay.
I had 4 miscarriages, all of them at the second trimester, some 16 weeks, some 20 weeks. The hospital did 2 cerclages. Both of them failed. So now I would like to know what causes it. They did all kind of tests, because after the second miscarriage, they did all kind of tests. They inserted the camera inside my uterus. They did different kinds of tests, blood tests, all kind of tests. They noticed that I have a PCOS, polycystic ovarian syndrome.
Okay.
But they said PCOS doesn't cause the miscarriages
For
that
sure.
are recurring. So they tried the seclage during the third pregnancy. It failed. They tried it again during the fourth pregnancy. It failed.
Okay,
now
Ntando.
they are currently continuing with the test. So I would like to know what causes the incompetent cervix.
All right, so a question more really looking at obstetrics and a mix of gynecology in this sense. Incompetent cervix. Very quickly, Doc, before we wrap things up.
All right. So I mean, and in terms of Ntando's problem, I mean, it really has nothing to do with the topic at hand, but it has everything to do with the cervix itself. So you get aberrations or problems with the cervix, and if they're saying they've actually diagnosed that it's an incompetent cervix, what they then probably need to do is that, I mean, if they've done a cerclages, we've got different types of cerclages, by the way, Ntando, on which your obstetricians and gynecologists that are taking care of you will be able to assess and tell which type of a cerclage can actually offer you the best in terms of actually, giving you a chance into falling pregnant. So if they've done cervical cerclages, obviously I can't talk because I don't know the merits of the case much more. But if they've done, the conventional cerclages and they're still giving her problems, then they need to consider there's other types of cervical cerclages. There's some that actually come with more of a specialized type.
Okay.
And that's if they've really diagnosed and confirmed that the cervix is actually incompetent.
All right. Thank you so much, Doc. Thank you for joining us this morning as we discussed cervical cancer, looking at, the type of lesions that you would have and all the problems that are associated with having cervical cancer. And of course, touching on HPV. And that's what we're going to continue discussion with a little bit later on. That was Dr. David Maringa. And of course, after the break, we will have a discussion and continue this chat on cervical cancer and looking at HPV vaccines as well. We'll see you after the break. Welcome back. This is Vital Signs. Millions of girls are at risk of cervical cancer as parents reject the HPV vaccine. Misconceptions and skepticism around HPV vaccinations in a country has been deemed as the reasons why parents are not vaccinating their children. We continue the discussion with producer Zama Butelezi and what she had the discussion with Mangwana Nkebele.
Mangwana, now you have a daughter who is 6 years old, and for parents, we are told that it is very important for our girl children, even boys, to go for the HPV vaccine when time comes. Are you one of those parents who are saying, definitely when the time comes, I'm taking my daughter there, or are you a skeptic as well?
I have the responsibility to take care of my child because I'm her caregiver. So I think it's definitely something that I am open to and I think is necessary. I mean, having had the scare, and if I'm able to at least give some sort of vaccine that can help my daughter, I think it's definitely something that I'm looking at once she is of age.
Parents who are skeptical of this vaccine have been saying that, are we now promoting sexual intercourse early when our children are not even ready, even their bodies ready, both mind and body, for sexual intercourse? What would you say to those parents?
I think it's a responsibility of parents to make sure that we are contextualizing that information to our kids. Otherwise, we run the risk of them getting this information, and which they will. So if we don't talk about it, it doesn't mean they don't find out about it. The only problem is that they will find out in the different context without especially empowering, our girl child to understand the implications of the decisions that they take. So I think preparedness is very important, and kids absorb so much. And I guess you can also level it up to how you speak to a child of a certain age so that they can consume it in a way that makes sense for them and that they can understand it. But I think it's absolutely of paramount importance to make sure that we have those conversations. And to your point to say sometimes they're not, of age, I mean, it also depends on their circumstances as well. Sometimes these young girls find themselves in situations that put them there, into sexual, activity when they're haven't planned for it. So it's important that we at least empower them so that if they're faced with such a situation, their kids to know how to make the right decision for them.
The primary underlying cause of cervical cancer is the HPV, which is transmitted through the skin-to-skin contact and, of course, is a very common virus infecting most people at some point in their lives. There are many types of the HPV virus or the HP virus, and others, of course, have different types within them that infect cells and could lead to cancer. To talk about these and more, we're joined by Feni Mutwane, who is the Manager, Integrated Schools Health Program from the National Department of Health. Good morning and welcome to Vital Signs.
Good morning, Dr. Musa, and good morning to the viewers as well.
So let's jump right into it. We've slightly heard about HPV from Dr. Maringa a little bit earlier on, but from your perspective, from the Integrated Schools Program, what message about HPV do you drive?
From the Integrated School Health Program, we're actually driving the HPV vaccination campaign, which is a campaign that aims or is given the grade 5 girls in schools with the aim of preventing cervical cancer later in life.
Okay, so when you have this age group that you're looking at, this is largely an age group that we, would like to not have had sex yet or any sexual contact with anyone, hence not having had an HPV infection. So why are you targeting this age group specifically?
Yes, it's very critical to actually introduce or administer HPV vaccine to sexually naive girls or young girls who have not indulged in sexual activities, because it becomes very effective. That is why then it is targeting young girls between the ages of 9 to 14 years. However, the vaccine can still be safely given up to the age of 26 years.
Okay, so as the Integrated School Program, you're targeting young girls. What about young boys? Do they also get the opportunity to get the vaccine themselves?
Unfortunately, the type of vaccine that is given within the school health program is preventing cervical cancer. So it's only targeting girls. However, there are other vaccines that can be given to boys that primarily prevents genital warts.
Okay, so what strategy is the department taking with regards to getting these vaccines to the young girls on the ground? What sort of plans have you put in place? Are you targeting high schools as well, maybe to have some kids that aren't sexually active at that point in time? What strategies have you come up with?
Okay, the strategies that we use as government is jointly between the Department of Health and Education. We conduct the HPV vaccination campaign twice a year. So we've already had the first dose that took place in February and March in 2021. And currently, the second drive has started from the 6th of September and it will end on the 29th of October. So we've got HPV vaccination teams and school health nurses that visits all 17,000 primary schools, in the country to administer the HPV vaccine. So like I said, all the teams are out in schools currently administering the vaccine. But what is important is that we urge parents and caregivers to actually sign consent forms, because if a learner does not have a signed consent form, unfortunately the HPV vaccine cannot be administered to such an eligible learner, and that is actually a missed opportunity.
What kind of education are we giving the parents with regards to vaccine? I mean, we live in a world now where vaccines are still talk of the town, where COVID has come about, and there's a lot of vaccine hesitancy. We had a show about this last week. Do you feel there's the same amount of hesitancy towards parents allowing their children to get their HPV vaccine?
Generally not, because as Dr. Maringa rightfully said earlier on, since the inception of the HPV vaccination drive in 2014, we are now in the 7th year of administering this campaign, and over 3 million girl learners have been reached. And in annually, we actually reach or vaccinate 450,000 girls. So we have seen a good, cooperation from parents and caregivers. However, we do have sporadic situation where parents will not sign the consent form. Basically, I think it's because of misinformation. However, our school health nurses and HPV teams will then visit the schools through parents' meeting, then take the opportunity to educate the parents and caregivers. And also as a department, we have developed frequently asked questions and leaflets, in different languages that are distributed, are given to learners to actually share with their parents and caregivers at home.
So earlier on, you spoke about getting their first shot. So with the HPV vaccine that you're currently giving out to these school age going girls, how many shots do they have to take, and what are some of the side effects that parents need to be aware of, as well as the young girls with regards to getting the vaccine?
Okay, the current vaccine that is being given, you actually have to get 2 shots 6 months apart. That is why we have the first campaign in February, March, and then 6 months later, we follow up for the second jab, which is now in September and October. And as with many other vaccines and medication, of course, we do have side effects that are expected. So they range from fever, pain from on the injection site, and syncope in some instances. That is why when the teams visit the schools, they will take the girls in the groups of 5, not to scare each other, and to actually educate them first, and then group them and administer the vaccine. Thereafter, they will be observed for 15 to 20 minutes before the next batch of girls are taken into the vaccination room.
Have you perhaps had any pushback from either parents or other stakeholders that feel that giving the HPV vaccine is basically saying that these young girls can go have sex?
I think, yes, we've had such pushbacks. However, once we get to know about them, we try by all means to address them by deploying our health promoters in such communities or in schools or in designated areas where those are reported. So, and that is why we also, appreciate the opportunity like this one, where we are given to actually educate the parents and caregivers of the importance of getting the HPV vaccine, because this is very critical to prevent cervical cancer later in life.
Thank you so much for joining us this morning and really addressing this issue of HPV vaccination in young girls. I think a lot of people sitting at home maybe have that chat with the young girls that are in the house, but do remember that boys and young girls can get the vaccination just to ensure that that spread of HPV is not as high as we currently have it. That was Feni Mutwane, the manager of the Integrated Schools Health Program for the National Department of Health. After the break, Zama Buthelezi will take us through the latest South African COVID-19 numbers, and we'll speak to Dr. Marlon McKay to answer your questions around COVID-19, and anything else that you may have on your mind. Stay with us.
A very good morning to Vital Signs viewers. I'm Zama Buthelezi. The current surge in COVID-19 infections seems to be showing signs of a sustained downward trend. This is according to the National Institute for Communicable Diseases, the NICD, a division of the National Health Laboratory Services that continues to provide laboratory-based surveillance to inform the public health response towards COVID-19 in South Africa. Although this is great news, we need to remember that the Delta variant, which is more transmissible, is still around, and we still need to take precautionary measures, but most of all, vaccinate. For now, though, let's take a look at the national COVID-19 statistics. To date, 17,410,204 tests have been processed in the country. Positive cases to date, 2,886,331. People who have recovered, 2,743,865. Active cases, we are seeing a decrease. We're now at 56,000 and 90,000. But sadly, 86,376 people have died from COVID-related illnesses, and we're sending our sincere condolences to their families. So what's happening in the provinces, looking at the provincial breakdown of new cases, the 7-day moving average daily numbers of cases has decreased. Gauteng remains the epicenter of the third wave of the pandemic, with a huge drop in new daily infections compared to KwaZulu-Natal, the Western Cape and the Eastern Cape provinces, where majority of new cases lately come from. And also there has been an increase of hospital admissions. For now though, let's take a look at the infection numbers recorded in the provinces with big metros. KwaZulu-Natal in the last 24 hours has recorded 594 cases, followed by Western Cape with 366 cases, Eastern Cape on the third spot with 329 cases, Gauteng with 256 cases. While the infection rate is finally showing clear signs of declining, Mpumalanga and the Northern Cape are showing fewer numbers of people taking the COVID jab. Hopefully more people can have some courage to go and receive vaccination. Otherwise, we risk going through more of the same harrowing COVID-19 tragedy in the future. Remember, the only way to avoid another peak is for everyone to be vaccinated. For now though, let's take a look at the numbers recorded in the remaining provinces. So in the last 24 hours, Free State has recorded 297 cases, followed by Northern Cape with 122, Mpumalanga recording also 122 cases, Northwest 83, and Limpopo 28. Vaccine registration and inoculation is still open for those ages 18 and over 16,000 people have been vaccinated to date, according to the NICD. We are all urged to register and go out there in numbers to vaccinate to lower severity and hospitalizations. Let us all continue to take precautionary measures, and these include regularly washing our hands with soap and water, sanitize using sanitizers containing 70% alcohol content, wear a cloth mask that covers both our nose and mouth, practice social distancing and ensure proper ventilation indoors. Lastly, avoid mass gatherings. If you believe there is a chance you may be infected with the virus, call ahead to seek medical help from your healthcare provider or use the public hotline. It's a free number, 0800-029-999, and alert them to your symptoms. Remember to protect yourself and protect others. Back to you, Musa.
Thank you so much for giving us those numbers. It does look like things are looking a little bit better, but that does not give us any excuses to relax and take things easy. Still talking COVID-19, and of course, Dr. Marlon McKay is with us to have all those discussions and address all of our issues. Doc, how are you today?
I'm very good, thanks. Thanks for having me again.
Good. So I want to talk about long COVID, this term that we've heard being thrown around from time to time. What does that mean?
Yeah, so it's basically long COVID is a syndrome of symptoms that still persist after you've had COVID. We don't know, is it part of COVID? Is it a new syndrome that happens after COVID? But essentially it's persistence of symptoms. So you've had COVID, doctors say better, you can come out of isolation, but you're still sick, you still have lingering symptoms. And the common ones are brain fog, fatigue, body and pain, feeling weak.
All right. So, Dr. McKay, we're having a bit of a connection issue. We'll reconnect with you now. But I think what we're really trying to address here is the issue of long COVID, where people have felt themselves getting the COVID infection, getting tested, having the swab up their nose, coming back with a positive result and being sick. But this illness didn't just, become self-limiting, where after a couple of days you find yourself in a position where you're feeling a little bit better and life continues as if nothing has happened. What we're actually seeing is that a lot of patients are coming back months down the line, still complaining of respiratory symptoms, complaining of joint pain, of fatigue, and things along those lines, which then brings about the question, are you having long COVID or are you reinfected once again? And that's a question, of course, that can be very, very easily answered by Dr. Marlon McKay. So, Dr. Marlon McKay, I see you're back with us with a better connection. Let's address that issue. If you are someone that has had COVID before, but these symptoms are continually persisting, might you have COVID again, or is this just long COVID?
It's most likely long COVID. Remember, once you've had COVID, you've essentially built up enough antibodies to protect you against a new infection. Okay. So the risk of having a new reinfection is very, very low. So it's most likely what we call long COVID. And these are milder than the actual COVID illness. So it's things like brain fog, headaches, fatigue, weakness, post-COVID cough, breathlessness, abdominal issues. So it's quite distinct from the actual COVID illness.
So let's talk about vitamins and all these supplements. I mean, when COVID started, the big thing was go get some ginger, go get some lemon, take all these vitamins and things such as that. Is this helpful at all? Should people go out and get these vitamins?
Yeah, so that's such a good point. Basically, what we felt with regard to the vitamins is that they're not going to prevent you from getting COVID. But in the event that you do get COVID, they may benefit in terms of getting severe COVID. And so we all started pumping. And even during the acute illness, we just prescribed high-dose vitamin C and D. My personal feeling right now is that if you've had the vaccine, and this is why it's so important to get the vaccine, because if you've been vaccinated, there is your protection against severe illness. There's your protection against hospitalization. So it takes away the need for pumping yourself with vitamins.
So vitamins, I mean, have been spoken about in all terms, where people have actually said they're not going to get vaccinated. They'd rather boost their immune system naturally or taking these supplements. Is there really an argument for that? Is, taking these vitamins better than getting a vaccine?
Absolutely not. There is no medical basis that taking vitamins, number one, strengthens your immune system. Number two, is going to give you any better protection against COVID compared to the vaccine. Remember, this is not about the strength of your immune system. This is about having antibodies to a specific virus or illness. The vaccine gives you those antibodies for protection. Vitamins just make you feel better. And in the words of our esteemed Professor Harry Septel, all the vitamins are doing really is giving you expensive urine. So be careful about thinking it can boost your system to prevent COVID. Not a chance.
Okay, so we've got Bongi from Soweto who'd like to ask a question. She recently got vaccinated. Bongi?
Hello, Tia.
Hi, how are you?
I'm fine, thank you.
Good. We've got Dr. Marlon McKay. Ask your question, ma'am.
Oh, yes. Are you giving me the answers?
Sizoyi-answera but fanele kusiphi question angithi kuqala.
Oh, okay, sweetheart.
Yebo.
Ngibuye kuyohlaba Saturday. So mangibuye kuyohlaba, bengi-right, bengingana-next. And then mangivuka on Sunday, sengivuka this right side yami. Ngathi ngine-cloth or something la under my abdomen.
Under your abdomen?
Yes. So it was so painful Sunday, Monday. And then yesterday, ngaba na this thing yokuthi ngiphathwa yisizi ngibanjani. La ngihlabe khona bengingenanix, but from Monday ngizwa this pain. And then izolo mangiyibamba i-thick.
I-thick ingalo ivuvukile.
Ayivuvukalanga but mawubamba la kuqinile.
Kuqinile. Okay, all right. No, sizwile question yakho. Sizwile question mangizothi Dr. Marlon McKay I answer her. So doc, very simple question. She says she went to go get vaccinated on the Saturday. Since then, some dizziness, has had, these lumps, she says, on her lower abdomen. But of concern is this hard pain that she feels in the deltoid, where I'm assuming where they gave her the vaccine. So what do you think is going on there?
Yeah, so she's obviously experiencing some side effects from the vaccine. We know it's a deep intramuscular injection, so it can cause some swelling, pain on the arm, and sometimes even a knob where the injection was given. So some analgesics, some simple painkillers, and something to rub over the arm is important. It's not going to should not get worse. It's part of the side effects. Please don't let it put her off getting the second jab, which is very important. If it does persist more than a week or so, then she must please go back to the clinic and get the necessary assistance.
All right. Thank you so much, Dr. Marlon McKay, for joining us today and answering all those questions. And I hope Umambongile sorted out and that she got her answer. Very important to know that once you've gotten the vaccine, of course, there are local side effects. But that we mean that over where they've injected you, you could have some swelling, you could have some underarm swelling, and of course, other issues as well. But hey, don't let that deter you from going out and getting the vaccine. The numbers are looking good. Let your name be under those people that have gone out to get their vaccinations to get us back to where we were before COVID. Thank you so much for joining us, and thank you to the guests that participated in our discussion around cervical cancer as well as HPV vaccination. Of course, it's still a pandemic, so stay safe and look after each other. From me, Dr. Musa Winkosi Mtombeni. See you soon. Bye.